Hi, welcome back to Chai with Chalk, and if you're new here, welcome. So, today we're going to be interviewing an occupational therapist. So, if you're interested in that, let's jump right into the video. Woo! So, today I'm joined by.
I'm Shubhangi Gupte. I'm occupational therapist, and I work in acute care settings in a hospital in Virginia.
Okay, thank you so much for joining me. So, can you describe what an occupational therapist is and what do you do as one?
So, an occupational therapist, we treat injured or ill patients through the therapeutic use of everyday activities. So, they help patients recover and improve from the illnesses so that they can function normally in their daily activities. So it is kind of an holistic approach that occupational therapists use so the patients can function normally. So we work in different practice settings such as acute care hospitals, outpatient settings, skilled nursing facilities, home health, also early intervention for infants, community health, and mental health settings. So there are different kinds of settings that occupational therapists can work in.
Wow, that's a lot of different settings. So, what specifically, like, what type of injuries do you treat?
So since I work in acute care hospital, we get, and my hospital is a level one trauma center. We get a lot of patients after a traumatic injuries, so spinal cord injuries, traumatic brain injuries, people with strokes, amputations, different types of surgeries like cardiovascular surgeries, the bypass grafts after patients had an MI or even before, orthopedic surgeries, total hip replacements, knee replacements. So it's a huge variety of people that we see in acute care. So my job as an occupational therapist in the acute care settings is I get referrals. We get referrals from the physicians even as soon as the patients are in the emergency room. So we start our evaluation there. I have to get to find out the medical history, what's wrong with the patient, what's exactly is going on. And then during my evaluation, I ask the patients questions about their prior level of function, what they were able to do, and what they want to be able to do, and then assess their abilities to perform daily tasks like getting out of the bed, be able to walk to the bathroom, be able to stand and do activities. It are daily things that we have to do when we are home. Then after I do my evaluation, I develop a treatment plan, which includes, what their specific goals are, and then work towards those goals by giving them specific activities which can help achieve the goals. So it would include, exercises to make sure that they're strong enough to perform activities, improve their endurance, improve their lung capacity. So they have to be able to get back to their normal life. I have to collaborate with other disciplines such as physical therapists, speech pathologists, and case managers, and then we develop the discharge plan. And then I have to talk to the physicians, and we what I recommend, after talking to the other disciplines, what would be the safe discharge planning for the patients. So which would be, whether they're safe to go home, like after they're stable medically from the hospital, or they have to go to some rehab hospitals. And then we have to decide what level of rehab each patient needs, whether they need a higher level of rehab, like inpatient rehab or a skilled nursing facility, or they can go home with home health, or they need outpatient. So those are the things that we have to determine before the patient goes home from the hospital.
Wow, that's a very complex process. So basically, an occupational therapist kind of helps with recuperation after surgeries or injuries. Then what is the difference between an occupational and a physical therapist?
So each profession has a specific scope of practice that is required, regulated by state licensure. In general, physical therapists treat specific areas of body to improve strength, movement, balance, and to improve the quality and safety of mobility. As a comparison, occupational therapy assists patients to participate in activities of everyday life the patient needs to do and that they want to do. A great resource to review for further differences between these fields is to visit the websites of American Occupational Therapy Association and American Physical Therapy Association to get a better idea about specific differences.
Okay, got it. So the basic gist is that like physical therapists would treat like a knee injury, but occupational therapists would help someone brush their teeth.
Yeah, be able to stand up, like from after knee replacements or knee injuries. Physical therapist, yes, will make sure that the patient can walk, okay, properly according to the weight bearing status, and that, and occupational therapist will make sure that yes, they can stand and perform, like brush their teeth at the sink, be able to walk to the bathroom, get in and out of the tub. So how the mobility will be more functional to perform their activities of daily living.
Okay, so what made you choose this career path specifically?
Oh, so I always like to help people and ill people. And I had watched my uncle, who is a doctor in India, saving lives. So I was attracted towards a medical profession. But when I saw him doing home visits in the middle of the night, I'm like, oh, I don't want to do that. So I still want to do something in health career, allied, but I just don't want to go into medicine. So occupational therapy, I saw that it gives more flexibility and that I could spend a good amount of time with family and also have a stable career while going working towards my passion to help people. So that's what when I decided that I would like to go into occupational therapy.
Oh, that's so interesting. So, what college did you go to? And do you have a specific reason why you chose that college?
I went to a GS Medical College, which is affiliated with the KM Hospital and the Bombay University in Mumbai, India. Well, the reason to choose that college is that's the number one medical school in the state of Maharashtra in India. And we have very talented faculty and all the head of the departments, the HODs, we used to call them, of all the different faculties. They taught us all the subjects in therapy. So, like anatomy, physiology, pathology, pharmacology, medicine, all kinds of surgeries like cardiovascular surgery, plastic surgery, ortho surgery, all of those subjects were taught to us by the head of the departments, the very famous doctors. And that's why I said, oh no, this is the school that I would like to go into. And I was able to get admission to that. So it worked out.
Wow, sounds like an amazing school.
Yes, it
So,
is.
yeah, so in your job, how would you describe your work environment? Like, is it stressful? Do you have a lot of time to socialize? Are people very serious?
Yeah, it is a very high pressure job to work in a level one trauma center. The people, all the staff and the people who work there are very friendly. So the friendly environment makes it really easy to work. So all my colleagues are really very professional and they love what they do. They're very responsible, and that makes it as not as stressful, as it can be. And yeah, we do a lot of social activities out of work. It's not there's no time to do much social activities during work hours, but we definitely spend time with each other later on, in the evenings or so.
Oh, that's nice. So you mentioned level one care facility. Is that what you said? Uh,
Yes.
I think I got the gist of it, but can you just quickly describe what that means?
So level one trauma center is you have to be really, it is approved by the state, and you have to be really able to see all types of trauma patients, like gunshot wounds or motor vehicular accidents. So there are certain requirements that the hospital has to fulfill, that they have to have trauma surgeons, orthopedic surgeons on call 24/7, and be able to have the staff that can handle such patients. So we have to go through extensive education to qualify for a level one trauma center. And we can also take burned patients. So that could be pretty intense to work with such people, and we have to, the therapy starts at our hospital, like I said, from right from the emergency room. So as soon as they're admitted in the ICU, even when they're on the ventilator, we work with the patient so that they don't lose their strength and range of motion.
Oh, so you mentioned that like specifically your career path took a lot of special training and you went to a very like top ranked school. So for anyone interested in pursuing your career, in addition to like going to a good school and getting all this special training, what other things would they have to do to pursue your career?
So if you're interested in occupational therapy, you got to kind of start to see what schools you want to apply to. You can start off with shadowing occupational therapy in different settings. So shadowing in one way helps to find out for yourself whether this profession is for you or not. And the other important thing is it is a requirement. It is a requirement for applying to OT schools. So you can choose different settings that you want to shadow an occupational therapy in. So you get exposure to a variety of different things, like I said earlier, that we work in different settings. So that gives you a real good idea about the profession. You can also start talking to your college academic advisor that what prerequisites are offered in the school, and also go on the online, do your research, your homework to see what prerequisites are required by particular schools. Usually the prerequisites are quite similar to most of the schools, but it would be good to go on and see what specific requirement each school has. You can also take your GRE, because that is also a requirement. It is all of the occupational therapy programs are master level programs, and some are doctorate level. So you want to make sure that you got all those things done too.
Okay. So in general, with your work, since you're working in such like a level one OT facility, how do you manage to maintain a work-life balance?
Yes, so it is hard to do so, the work-life balance, as in any medical profession, as I also have to work some weekends. So what I do is I just plan ahead, and I try to cook some meals ahead of time, like on a weekend for the next week. And if I'm working on the weekends, and I have to plan accordingly on my day off to do the chores that I want to do. Also, as I said, the profession offers flexibility. So what I do is I choose to go in earlier on during the summer days, and so I can come back early and spend time with my family. My colleagues and I, we collaborate together, and then we work to get some time off during the spring breaks, because as you know, in health profession, you don't have very many days off, and you have to plan your vacations. So not everybody can get every year the spring week off, so that helps that we collaborate, and then we take turns to take the spring week off. So I think it's mainly the time management and just planning ahead, that helps me to keep the balance between my work and my social, their life.
Yeah, and as a follow-up, I know that we're kind of like exiting pandemic restrictions right now, but how did the pandemic affect like your work-life balance and how you practiced as an OT?
Oh, yeah, that's a good question because yes, this pandemic affected each and every one of us in different ways. So initially, yes, last year when the pandemic hit us, we definitely had a lot of patients with COVID admitted in the hospital. So we all had to learn how to, deal with all that because we didn't know much about the virus at that time. So it was a lot of fear, even wearing and taking the PPEs off, that, whether we're doing it the right way, even though we had, the education given was education was, we were educated about how to do that, even though there was that fear in our minds, but then we got through with that. It also affected our hospital admissions because initially, when we had so many people with COVID admitted to our hospital, we didn't get the other types of patients. I guess people did not go to the hospitals as much as that time. So the hospital admissions did go down for some time. But then people also, I guess, understood that we do have, separate rooms and floors for patients with COVID, and the other patients are treated separately. So I think that helped too to get the admissions. I mean, we still have patients with COVID, but now I think we are able to manage them and know how to, work with them better off. We still have to wear masks as soon as we go in the hospital. We have to put a mask on, and we cannot take it off until we step out of the hospital. So that definitely is a big, huge change, right? That we didn't have to do before this pandemic.
Yeah, right. Definitely lots of mask wearing, which I think will still continue for quite some time. But you already gave a lot of really good advice about like more like college centered stuff. So, as a kind of final wrap up, what kind of advice do you have for high school students who are interested in entering your profession?
So while you're in the high school and you're thinking of, what career to choose, like you are right now, and you're rightfully. So what you could do is volunteer in under an occupational therapist, and as I said, just go and work with them, volunteer under different settings, just to see that this is what you really want to do. And you can also get your CPR certification because that also helps. Even taking like classes like anatomy, that could also help you to get some experience about the classes that you would have in occupational therapy school. I would say that also set yourself apart from an average student as when you go to undergrad school. So do your homework, and also when you are going to undergrad school, you can find out what are the prerequisites that the OT schools have, and then work on those. But definitely it would be a good start to start while you're in high school, to just get familiar with what occupational therapists do in different settings.
Okay, thank you so much for this interview. I loved everything you said.
Oh, of course. Thank you. Thank you for having me. And I hope that was helpful.
Yes, it definitely was.
All right. Good luck, Sanika.
Thank you.
You're welcome.
Thank you so much for watching, and I hope you enjoyed this video. Don't forget to like and subscribe, and comment down below any professions you'd like to see me interview or any questions you'd like me to ask. Thank you so much, and see you in the next video. Bye!